I want to introduce to you Dr. Lindsey Criswell. She's Chief of Rheumatology at the University of California, San Francisco.
Okay, good afternoon. It's a pleasure to speak today and to tell you about human autoimmune diseases, their impact, and some recent progress identifying genes that contribute to these disorders. Next slide. So I'm briefly going to describe what autoimmune diseases are, what we're learning about causes of autoimmune diseases. I'm going to focus on genetic factors. And then I'll describe some striking recent progress identifying genes for human autoimmune diseases. And then I'm going to summarize why this information is very important for patients and their families. And lastly, what are some next steps, including opportunities we have now and some obstacles. Next slide. So human autoimmune diseases arise when the immune system, which normally protects us from infections, other foreign invaders, instead attacks normal cells or tissue in the body. That causes damage to those cells or tissues that are under attack by the immune system. Now, often in these diseases, we see autoantibodies that circulate that are mediators of this damage. And then the specific disease that develops reflects the specific cells or tissues in the body that are attacked by the immune system under these circumstances. And as you'll see, there are important roles for both genes and environmental factors. Next slide. The impact of autoimmune diseases is tremendous. Over 20 million Americans are affected with one of 100 or more autoimmune disorders that have been defined. They're striking for their overall female predominance. On average, about 3/4 of autoimmune disease patients are women. They're a very important cause of disability in the United States, probably the fourth largest cause of disability. And there are tremendous costs associated with this group of diseases: physical, psychological, social, financial. You'll hear more about those impacts from the other speakers. Next slide. So as I was describing, autoimmune diseases vary depending upon these particular cells that are affected or the organs that are affected in the body. For example, when the platelets, the blood-clotting elements of the blood, are attacked by the immune system, excessive bleeding occurs, and sometimes lifelong treatment with immunosuppressive drugs are required to control that problem. On the other hand, when the insulin-secreting cells in the pancreas are the target of the immune attack, insulin-dependent diabetes results, requiring lifelong treatment with insulin in order to survive. Now, there are other autoimmune diseases that have more generalized or systemic manifestations, such as rheumatoid arthritis, scleroderma, and systemic lupus. But virtually every organ in the body can be affected by autoimmune disease. Next slide. I have just a few slides here to illustrate some of the tremendous impact on the individuals affected with autoimmune diseases. This slide shows us the tremendous deformity and damage that can occur in the joints of an individual with rheumatoid arthritis. Next slide. Lupus affects many different parts of the body, including the skin, sometimes resulting in a very disfiguring sort of skin rash, which is difficult to treat. But internal organs are also affected in lupus and cause tremendous problems with requirement for treatments that have terrible side effects and even early mortality. Next slide. Scleroderma is another systemic autoimmune disease in which the skin is affected, in this case primarily with tightening and thickening and fibrosis of the skin. But unfortunately, this fibrotic process occurs throughout the other organs in the body: the kidneys, the lungs, the heart, the gastrointestinal tract, a devastating disease for those affected. Next slide. What about the importance of genetic factors? This slide shows two sets of identical twins, mine and my research assistants. And twin studies have been very, very useful in identifying the contribution of genes to autoimmune diseases. What we've learned from twin studies is that even though all four of these little girls are at risk of autoimmune disease because of autoimmune diseases among their parents, most of them will probably be spared. And even if the identical twins here, Nina, for example, develops an autoimmune disease, her co-twin still has a very good chance of leading a normal life. Next slide. So autoimmune diseases, like most human diseases, are genetically complex. That means that multiple genes, together with factors in the environment, work together, probably along with an important role of chance in determining who is going to get the disease and how bad it's going to be. Next slide. Now, just a couple of words about environmental factors. there is some very strong data to implicate specific factors in the environment in these diseases. For example, multiple sclerosis is much more common in areas with lower sunlight exposure, implicating an important role for vitamin D, which requires sunlight to have its full effect in the body. Next slide. On the other hand, recent research strongly implicates particulate air pollution as a risk factor for rheumatoid arthritis, so that individuals that live in areas like this, where I grew up, for example, are more likely to get this disease. Now, nonetheless, in spite of the importance of environmental factors, it's clear that genes are also important. And I've summarized some information about the genetic contribution to a series of autoimmune diseases in this slide. What this slide shows is that if you look at the likelihood that a sibling, a brother or sister of an autoimmune disease patient will get the disease, compared to just the background frequency of that disease in the population, there's a striking increase in the risk of disease for siblings of affected individuals, a 6-fold increase for siblings of psoriasis patients, 20 to 30-fold increase of disease among close relatives of a patient with multiple sclerosis or systemic lupus. Next slide. Now, there's been tremendous progress in the last few years identifying genes for complex diseases like human autoimmune diseases, attributable to the success of genome-wide association studies, or GWAS, which have only recently become feasible. Next slide. So this slide summarizes the tremendous success of these projects. What is shown here are all the chromosomes in the body, and every place where there's a colored circle, that represents the location of a gene that's been implicated in a human disease as a result of these sorts of studies. The colors refer to specific diseases, and many of these colors represent autoimmune diseases. So we've made tremendous progress in identifying the genes that contribute. Next slide. And just to give you a flavor for what these studies entail, this slide summarizes the results from one of those GWAS studies of rheumatoid arthritis. To succeed, this study required 5,000 rheumatoid arthritis patients, over 7,000 controls, genotyping with hundreds of thousands of genetic markers, each one represented by a dot here, covering all of the chromosomes in the body, shown according to different colors, and the genes or gene regions with strong signals of genetic association are the ones that are shown in this part of the graph. Next slide. So, as a result of these studies, we've made tremendous progress in the last few years in identifying genes for autoimmune disease. Next slide. Now, one of the early findings that emerged was as we started identifying genes for one autoimmune disease, we saw that they were also increasing risk of other autoimmune diseases. And this has allowed us to connect these different autoimmune diseases with molecular links through genes that are common risk factors for those diseases. Next slide. And as more information has emerged from these recent studies, more and more biological links between different groups of autoimmune diseases have emerged. Next slide. Now, a striking finding from these results, when you look at them together, is the extent to which these different genes that have been identified map to specific biologic pathways in the body. For example, this key immune cell signaling pathway, which is represented here, has shown evidence of association with multiple autoimmune diseases because genes in this pathway, all of the ones with stars, have been implicated in these GWAS studies. So it gives us a great handle on the biological causes of disease. Next slide. Now, what has made these studies possible? Certainly the resources of the genotyping capacity, the laboratory and analytic capacity, but also consortia of scientists supported by patient organizations have been crucial to this success. I'm highlighting here one, the Multiple Immune Diseases Genetics Consortium, because it's played a very important role in these studies, led by Peter Gregerson, my colleague in New York. Next slide. Now, what this consortium did, and ARDA, for example, was very useful in this respect, we looked for families. This is a family tree in which multiple members were affected by multiple different autoimmune disorders. Look at the burden of autoimmune disease in this family. Every solid symbol represents someone in the family with an autoimmune disease: lupus, rheumatoid arthritis, thyroid disease, psoriasis, etc. Next slide. So through studying these families, we've been able to identify a number of genes that contribute to multiple different autoimmune disorders, such as this gene, PTPN22, which increases the risk of rheumatoid arthritis, lupus, thyroid disease, but interestingly not some other autoimmune disorders such as multiple sclerosis. Next slide. Interestingly, too, the frequency of this gene varies widely around the world's populations, presumably explaining to at least some extent the different frequency of autoimmune diseases around the world. So this gene happens to be very uncommon in the south of Europe and very common in the north of Europe, for example. Next slide. Another general autoimmune gene that has been identified through work in the MAGIC Consortium and other studies is TNF-AIP3 that works in that immune signaling pathway that I showed you a few slides back. Next slide. So how has this information helped us? First of all, as I've tried to illustrate, it has highlighted for us key biological pathways that we should be targeting with our treatments. We didn't have that knowledge before all of this recent work in genetic studies. Secondly, patterns of shared genes across diseases should tell us something about groups of diseases that are likely to respond to the same treatments. And this will allow us to prioritize the very lengthy and costly process of it testing some of our newer therapies for autoimmune disorders. This information is also providing very useful prognostic information. For example, we know now that specific genes help determine how severe or mild an autoimmune disease is going to be in an individual and what disease complications they're most likely to develop. For example, who's at risk of kidney disease in lupus? Next slide. So what are some of the next very important steps to move forward in this process? First of all, the recent studies have told us which genes are important and which pathways. They have not told us which variants are the actual causal variants within those genes. That requires new approaches, for example, through genome-wide sequencing. We also need to understand better how those causal gene variants actually cause the disease. It's that very specific information that will inform the development of novel therapies that will be more effective because of their specificity, and also suggest approaches for intervening very early on so that we can prevent or cure these diseases once they've developed. Next slide. However, there are some very important obstacles to making progress in this area. First of all, the new technologies are expensive, limiting access to smaller and smaller groups of individuals. There's an urgent need for large collections of well-characterized autoimmune disease patients, such as was developed through the MAGIC and other consortia. However, funding for those efforts is decreasing, not increasing, at the time when we need them most. Further, diverse population groups are needed to ensure that all patients benefit from this information, and many population groups in the U.S. and elsewhere don't have the same opportunities to participate in this research as others. And lastly, I think terribly important, there are major obstacles related to the training of the next generation of physician scientists and medical researchers because we are no longer investing in training and educating the investigators needed to take these research studies to the next logical step. Next slide. So what has it taken to get to this point? It's taken a lot of resources from the NIH, other academic institutions, industry partners, consortia, next slide, such as this rheumatoid arthritis consortium that's been working hard in this area since 1997. Next slide. This Sjogren's syndrome collaboration that's worldwide and has been working very hard to identify genes that contribute to Sjogren's syndrome. Next slide. Each one of these investigators has a hard-working group of research assistants and trainees, like my group in San Francisco. Next slide. And the patient organizations, such as the sponsors of this meeting, are terribly important in moving this work forward. Last slide. And most importantly, the autoimmune disease patients themselves, such as these three sisters with lupus, who have been eager volunteers for some of our work in lupus genetics. Thank you.
Thank you for that overview. We're going to now put a human face on this disease and ask Dr. Nicole McDonald to come up. Dr. McDonald is a certified internist in Massachusetts. She has a solo practice. She also serves on the board of directors of the Graves' Disease and Thyroid Foundation, and I believe members of her family are with her, and she's going to talk about the impact of autoimmune diseases on families.
Thank you. There we go. Hi, as he had mentioned, I'm a board-certified internal medicine physician. And throughout my training, I was taught about the basics of various autoimmune diseases. But no formal education could have prepared me for the intensity and complexity of having a child with autoimmune disease. My daughter, Alex, who I think they wanted her to come up. We'll see if she comes up. She's a little bit shy. She was diagnosed with Graves' disease 3 years ago at the age of 8 years old. Graves' disease is an autoimmune disease of the thyroid where the body attacks its own thyroid gland, producing too much thyroid hormone. She'd been displaying symptoms of overactive thyroid for about 1.5 years prior to her diagnosis. But due to the rarity of this disease in children, it affects only 0.02% of all children. It was really difficult for a diagnosis to be made. Her symptoms started very gradually with increased mood swings and anxiety. Her moods became so erratic and very bothersome to her sisters and the rest of us in the family that we decided to try some counseling. So we put her into counseling, and the psychologist came up with the diagnosis that she was just a spoiled brat. Literally, that's what she told me. Then things started progressing slowly, where she started having an insatiable appetite. She would eat 3 breakfasts a day, just never, ever be full. Then other things happened. She'd start walking around, taking all of her clothes off, and pretty much hanging out in her underwear. And we live in the Northeast, even in the winter. You know, as a physician, you'd think I would have picked up on these things, but they happened so gradually. She started having hand tremors, but my husband has hand tremors, so I kind of assumed it was just familial. And then her handwriting became messy due to the tremors. Her grades in school declined. And one day I was looking out the window at the kids playing in the backyard, and I was trying to figure out who that skinny girl in jeans was. And then I realized that was my daughter. So we were sitting in the kitchen one day, and she was looking up, and all of a sudden, I noticed her goiter, which is an enlarged thyroid. So I immediately called the pediatrician. It was like the aha moment. I put everything together and called the pediatrician, and he said, oh, no, things like that don't happen to kids, but you can do some blood work. So that's when we did the lab work, and she was diagnosed with Graves' disease. At that point, her disease was so advanced that her heart was beating so rapidly that she had to immediately stop sports, gym, just for about a month until the medicine took effect and her heart was able to normalize. So like most autoimmune diseases, there are no cures, just treatments that are suboptimal. The 3 options for Graves' disease are medication, surgical removal of the thyroid gland, or radioactive iodine treatment. So each option has the potential for serious, even life-threatening side effects. Alex has tried medication for the past 3 years, but she's not gone into remission yet. So we're still struggling to choose which treatment option we're going to try next because there's no perfect choice, so we're trying to gather as much information as we can. Children who have autoimmune disease at such an early age tend to develop more than one autoimmune disease. So in August, Alex was diagnosed with scalp psoriasis. Psoriasis is one of the most common autoimmune diseases, and the incidence in children is rising. It occurs most often as a red, scaly patches on the skin that itch. The dermatologist confirmed her diagnosis, but he went no further. So I knew of the connection between psoriasis and psoriatic arthritis. Up to 20% of childhood arthritis are diagnosed as psoriatic arthritis, which causes pain, swelling, stiffness around the joints, and it can be debilitating. So for over a year prior to the rash on her head, Alex had been complaining of pain in her heels. So they diagnosed her as having bilateral Achilles tendonitis. Put her in physical therapy. It wasn't getting any better. Once I saw the scalp psoriasis, I said, this certainly could be something more than that. So when I had taken her to the dermatologist, I asked him and told her about the pains, and he said, oh, no, there's no connection, don't worry. But thanks to the internet, I did a lot more research and found out that actually children with psoriasis and even as some adults, present with bilateral Achilles tendonitis. So at that point, I decided to take her to one of my rheumatology colleagues. And a rheumatologist is a joint specialist, for those of you not in the medical field. He immediately did an ultrasound of her heel, and he found that she already has an erosion in her heel bone. So at that point, he advised me that we needed to go see an ophthalmologist because there are other related diseases, something called uveitis, which is another autoimmune disease that patients who have psoriasis and psoriatic arthritis are definitely predisposed to. So psoriasis carries significant physical and psychological burdens in children. Physical symptoms limit the childhood activities such as outdoor exercise, participation in sports, and children with psoriasis can also face severe emotional trauma from bullying, discrimination, and self-consciousness due to the visible manifestations of the disease. And half of the children who have psoriasis actually report being bullied. As with most autoimmune diseases, there are no FDA treatments that have been approved for use in children and adolescents, so leaving patients to try medicines for their child, which there's very limited research and knowledge about pediatric side effects and adverse events. Now, doctors are not making the connection that autoimmune diseases are all related. The specialists seem to just be treating their disease and not looking at the whole picture as a whole. And early diagnosis is crucial because permanent joint damage, for the instance in psoriatic arthritis, can occur if they don't catch this early. So what frustrates me is that if I, as a physician, with a great deal of knowledge and resources, am having such a difficult time having my daughter diagnosed and treated properly, how is the person who's not in the medical field, doesn't have as much knowledge, how are they faring? So it's just very concerning to me. So it's crucial that we spread and educate the awareness of autoimmune diseases to both physicians and the general public. Now, autoimmune diseases tend to cluster in families, as we had seen with the earlier talk. So if you have anybody in your family with an autoimmune disease, you really need to talk to aunts, uncles, cousins, brothers, sisters, because there is certainly somebody else in the family that is either diagnosed or has yet to be diagnosed. And I'm embarrassed to say that as a physician, I never really looked at that connection until I became involved with the Graves' Disease Foundation, the Psoriasis Foundation, and the American Autoimmune Related Disease Association. And we'll start with my family. This is my connection. My mother, she was, there you go. She has ulcerative colitis, had been on many years of debilitating medication, and finally she needed to have her entire colon removed due to the ulcerative colitis. My father, who's not here today with us, he has Hashimoto's thyroiditis, which is underactive thyroid. All right. Next up, my sister. She has vitiligo, which is when the skin loses pigmentation, and she also has psoriasis. Also has some joint aches, but she hasn't gone to see a doctor lately. My first cousin, he has ankylosing spondylitis. And what that is a severe arthritis, especially in the lower back, which causes degeneration and debilitating disease and a lot of extreme pain. Now, autoimmune disease can cause significant stress on families. The behavioral issues and fluctuation of my daughter's moods have impacted our entire family dynamics. Her siblings have a hard time understanding and coping with her behaviors, and simple things like homework become life-shattering events. The financial stress can also be enormous. We're lucky to have a stable income, but the costs of doctor's bills, frequent lab testing, and medication expenses can certainly take its toll on the pocketbook. I have an elderly patient who I just saw a few weeks ago who has rheumatoid arthritis, and you'd seen a picture of the rheumatoid arthritis earlier. Her prescriptions right now cost her $800 a month. For 3 months out of the year, she'll be in what's known as the Medicare donut hole, where they don't pay for her prescriptions, and she'll have to pay $3,000 a month out of pocket to be able to live a somewhat normal life. And for an elderly patient, it's just impossible. When you're having to choose between rent and food or paying for your medicine, it's very, very difficult. And many people with autoimmune diseases are also financially strapped due to the fact that they lose days working, or they even have to go out on disability due to the permanent disability of these diseases. So autoimmune disease needs to be taken much more seriously. As a physician, I am frustrated with the lack of resources and lack of knowledge that many of my colleagues have about these diseases and about their connections. As a parent, I'm disgusted that these diseases, which are among the top 10 causes of death of all diseases, are so underfunded, and therefore there's such limited research being done. When life-altering decisions need to be made, especially on behalf of your child, any parent would like to be absolutely certain that they are making the best and most well-informed and safest decision as possible. There's absolutely nothing more heartbreaking than seeing your child suffering on a daily basis. So our family is just one of many out there, and we desperately need your help. Thank you.
Thank you, Dr. McDonald and members of the family. We're now going to move on to the policy implications of autoimmune diseases. The next speaker is going to address the emotional family cost implications of autoimmune diseases. I'd like to invite up Dr. Robert Phillips. He's the director of the Center for Coping in New York.
Good afternoon, everyone. You've been hearing a lot about the medical aspects of autoimmune disease, and you heard Dr. McDonald touch on the emotional issues as well. I'm going to prioritize the emotional issues. And let's start, first slide, please. I know there are people in here who have autoimmune diseases. There are others in here, obviously, who do not. But what I'd like for the benefit of my conversation with you, for everybody to imagine that you're living with an autoimmune disease. Imagine some of those factors. Often, if not always, feeling physically ill. Being uncertain about the future. Being afraid of the future. People who have not been diagnosed with illnesses believe that their life will go on indefinitely and they'll be fine. People who have been diagnosed with an autoimmune disease don't have those same reassurances. Not knowing where to turn. More and more health organizations are out there helping people, providing invaluable services. But what about certain parts of the country where those organizations are not as readily accessible, or those people who have less common autoimmune diseases where there is no such organization? Not being understood, having a hard time communicating to family and friends how you're feeling, what you're going through, either physically or psychologically. Not being able to do what you want to do, being inhibited. We'll talk about that more in a few minutes.